is here with us today. She is a longtime friend of mine. I've known her since undergrad, and today she will be teaching us about nutrition and her work as a registered dietitian specializing in oncology. Welcome to the Miss Appointment, Alice.
Thank you so much. It's so great to be here.
So I've always wondered what the difference is between a registered dietitian and a nutritionist. Can you tell us a little bit about that?
Yeah, so a lot of people get the term nutritionist and dietitian confused. They also use them interchangeably a lot, but there's actually a big difference. So a nutritionist can just basically take a weekend online course and get their little printout and become certified to coach people, tell them how to eat healthier, how many servings of vegetables they need to eat. But a dietitian actually has a 4-year bachelor's degree. They have completed a 1,200-hour internship, and they take a 3-hour-long registration exam. So they are registered in the entire country. Yeah. So we can work with more specialized needs, such as people with diabetes, if they have heart disease, cancer, things like that. We just have more of a medical understanding and scientific background.
Yeah, so a nutritionist is more of a general health advisor, right? And then you have a registered dietitian having more of a clinical experience and can work alongside health professionals.
Right.
So that reminds me of like an analogy of how supplements are compared to medical food. Supplements are very general type of, minerals, vitamins, anyone can take them. They don't have to seek medical advice for it, as opposed to medical food, which are also vitamins and minerals and a lot of fatty acids. Specific for a medical condition, and people have to actually visit a doctor to get prescribed a medical food.
Yeah, that's a great comparison, comparing nutritionist to dietitian and supplement and medical food.
Yeah. Tell me a little bit about your work as a registered dietitian in oncology.
So I actually work in an outpatient oncology clinic working with patients who are actively going through chemotherapy treatment, and I basically work with them to help them manage any side effects they may experience during chemotherapy. A lot of these chemotherapy drugs cause nutrition impact symptoms such as nausea, diarrhea, taste changes, their appetite can just decrease. So it's my job to really help them manage those side effects and make sure that they get enough nutrition, that they aren't losing a bunch of weight, and just make sure that they stay well nourished all through treatment.
Yeah, and even afterwards, you can also give them advice on how to basically maintain that type of health status.
Right, so afterwards, if they're interested in changing their lifestyle and changing their eating, then I'll kind of go in and help them make those healthier changes to possibly prevent the reoccurrence from the cancer coming back.
Yeah. Why do you think nutrition is so important for people undergoing chemotherapy?
So chemotherapy is essentially like an army coming in and causing war with the cancer. It's also causing a lot of destruction and damage to the body itself and the body cells. So staying well nourished during treatment and getting enough nutrition is going to help rebuild the body cells and help the patient pretty much recover better after each chemotherapy treatment.
I'm sure you get asked this a lot. Is there any ideal diet for people to follow? What are your thoughts on, say, like ketogenic diets, raw diets, or even the vegan diet?
So I typically recommend patients to find the best diet that works for them. There is a lot of research to show that a Mediterranean type diet or a plant-based diet can be beneficial in preventing cancer or preventing the reoccurrence from cancer after completing treatment. However, I think if you find that a certain diet works better for you, then you should obviously do what you think is best for yourself. I myself follow a more plant-based diet, and that's typically what I recommend to patients. So I like to practice what I preach and do the same thing for myself. Raw diets, it can be very beneficial because they do contain a lot of produce and healthy fats. However, they can be deficient and lacking in certain vitamins such as vitamin D, vitamin B12, omega-3s, calcium, things like that would have to be supplemented. You just can't get those from fruits, vegetables, and nuts.
Yeah. You mentioned vitamin B12, and I hear a lot about strict vegetarians who are more at risk for B12 deficiency. Tell me about how vitamin B12 deficiency is a high risk for those who aren't consuming any meat?
Well, typically B12 can only be found in meat. So if you're a vegetarian, a vegan, a raw foodist who's not consuming any meat, the chances are you're probably going to need to supplement, or you might become deficient in B12. There are fortified sources of B12, so some breakfast cereals, some yeast products might be fortified with B12. However, it's really hard to get enough B12 on just those products alone, so it's very important to consider a supplement. However, interestingly enough, I do know that a lot of meat eaters sometimes get a B12 deficiency. I actually have a really close friend that just discovered he had a B12 deficiency, even though he eats a lot of meat. And when he looked into it further, he realized he gets heartburn a lot, he takes these antacids, and in order for B12 to be absorbed in the stomach, you need a more acidic environment, and those antacids are preventing the absorption of B12 in his stomach.
So B12 deficiency is something that people need to be concerned of if they're not consuming a lot of meat, right? What are your thoughts on the iron deficiency as well? Because I know a lot of people who are vegetarians and vegans tend to be also anemic because of that.
Yeah, so iron is another thing that can be more difficult to get on a vegetarian or vegan diet, just because heme iron is only available in meat, and heme iron is the one that's more easily absorbed by the body. Plant-based sources of iron, also known as non-heme iron sources, can be available. However, sometimes in iron-rich plant-based foods such as spinach, you actually have to cook them first to help the iron become more easily absorbed in the body. So a lot of people who are eating raw spinach, spinach salads, they might not be absorbing all of that iron, so it can be a lot harder to get the iron that you need on a plant-based diet.
Speaking of cooking vegetables, you mentioned to me the other day about this research study that compared grilled vegetables versus grilled meat. Can you tell us a little bit about that more?
Yes, so I actually read on the National Institute of Health under the Cancer Institute section that there has been a lot of research to show that consuming grilled meat on a regular basis can increase your risk for cancer. So when you grill meat at a high temperature or over an open flame, you're promoting the development of these two compounds, heterocyclic amines and polycyclic aromatic hydrocarbons. And so when these two compounds are developed and you consume them, they become mutagenic in your body, which essentially means that they're altering your DNA and could potentially promote cancer cell growth. However, when you consume grilled vegetables, they don't contain the fat that meat contains, they don't contain the amino acids, so eating grilled vegetables is likely to not promote any cancer cell growth at all.
So it's in the grilling process where you have like the smoke coming up and it reacting with those compounds that you mentioned that's found in meat that's actually producing the byproducts that causes the carcinogenic risk.
Exactly. Right? So the polycyclic aromatic hydrocarbon is formed when the fat from meat drips down and mixes with the flame, and then the compound forms, gets on the meat, and then you eat the meat, and it increases your risk for cancer. So one thing you could do to prevent these compounds from going into your body is removing charred bits from your meat, or just not cooking them at such a high temperature.
Yeah, that's actually a really good tip. So I want to tie this all back in. I know you talk a lot about nutrition and diets. How does diet specifically help you practice your own self-care?
So self-care is essentially mindfulness, and diet plays a big role in my self-care because I know certain foods that I eat make me feel really good, and other foods I might eat might make me not feel as good. Right. So just being mindful of that and
listening to your body.
Exactly.
Listen to what it wants. Because there's no one diet, specific diet for everyone to follow, right? There's a variability in all of us. And also just to keep in mind that health is not about deprivation, it's about abundance. So choose food that nourish us.
Exactly. So if cake makes you happy, then occasionally just go for that piece of cake if you want.
Yeah, why not?
Exactly.
Well, thank you, Alice, for joining us today. And any thoughts, comments, or questions, let us know, and we'll see you guys in our next one.
My missed appointment is definitely sleep. I'm always trying to get more sleep, and I can just never seem to get enough.